All right, so good afternoon again. My name is Latrice Rollins. I'm an assistant professor in the Department of Community Health and Preventive Medicine here at Morehouse School of Medicine, and also honored to serve as the director of the National African American Child and Family Research Center, which we'll learn about a bit today. So I am going to pass to Dr. King Gordon to introduce herself, and then Dr. Brian McGregor.
Thank you, Dr. Rollins. Good afternoon, everyone. I am Tandika Gordon. I serve as the Associate Director for the African American Child and Family Research Project. I'm really excited to be here and to serve with Dr. Rollins and others on this awesome work. So thank you for joining us today.
Hey, good afternoon, everyone. I'm Brian McGregor. I am a co-investigator in one of the cross-cutting areas for the National African American Child and Family Research Center that focuses on criminal justice and health. Also a faculty member in the Department of Psychiatry and Behavioral Sciences at Morehouse School of Medicine, and look forward to the presentation, and maybe we'll get to some opportunities to engage with you all.
Yes, and I was just going to ask, since we have a small group, if you all could unmute and just introduce yourselves, that would be great.
Okay, thank you.
Anybody can start. Looks like Deborah Minor is off of mute. I don't know if you want to introduce yourself. Maybe she doesn't know.
Hi, I'm Tracy Chappelle. I work with the HIT division with Carmen Hughes. I think you all just saw her presentation of what Hybrid Solutions does. I am the program assistant that she was speaking of that keeps them on track. And I'm happy to be here to listen to see what you all are going to present today. Thank you.
Wonderful. Thank you so much. And Ms. Minor, Deborah Minor. No.
Well, my name is Kitty Carter Wicker, and I am the medical director for the Student Health and Wellness Center, for the AUCC Student Health and Wellness Center.
Wonderful. Thank you. Michelle Brown, you can introduce yourself.
Oh, good afternoon. My name is Michelle Brown, and I work with the Office of Minority Health, and I get the pleasure really of working with Miss Megan Douglas and Mitchell Blunt on the grant that they discussed this morning. Addressing health equity is very important to me, and I would like to hear your presentation, how this can start early on and not so much later in the game. So thank you for doing this. I appreciate it. Thank you.
Thank you so much. Okay, so the National African American Child and Family Research Center is fairly new project at Morehouse School of Medicine. We were just funded in September of 2021. Our funding comes from the Administration for Children and Families through their Office of Planning, Research, and Evaluation. And so with this presentation, I want to just share with you what we're all about, what we plan to do, our vision, mission, goals, and objectives. We'll also talk about the specific areas, those specific social determinants of health that our project addresses. So specifically, we'll talk about TANF, the temporary assistance for needy families, and economic mobility. And then we'll focus on our early care and education work. And finally, I'll close with talking about how we are setting a community-based participatory research agenda through using some community listening sessions, as well as just going through a community needs and assets assessment process. So I'll walk you all through that process. And again, since we are a small group, feel free to jump in. If you have any questions, if you have any comments, feel free to just jump right in as we go along. And yes, absolutely. If you have comments or things that you want to share, you can definitely put them in the chat as well. So if you're familiar with the vision of Morehouse School of Medicine, you will be familiar with our vision for the National African American Child and Family Research Center. So we are, our vision is to lead the creation and advancement of health equity, specifically for African American children and families. With this, our mission, though, is to provide national leadership and excellence in community engaged research to better serve African-American children and families. So we are a national center where, even though we are physically located in Atlanta, Georgia, we focus beyond Georgia. We are really focused on national efforts to improve the circumstances for African-American children and families. So our first goal around research is really to advance a community engaged and high caliber research program that's focused on African-American children and families. With this, and the way that we plan to do it is with that research agenda that I just referred to a moment ago, and really looking at some of the individual and environmental approaches that we can use to really look at some of the Administration for Children and Families programmatic concerns. The programs that they are specifically wanting us to focus in on, again, are TANF, their Head Start and Early Head Start programs, as well as the Childcare Assistance Program. So there are some specific areas and priorities that they have that they want us to look into. In doing this and setting a research program, we really are charged with collaborating with the community and with our partners to develop this research agenda. We're also a capacity building center. So we are looking to build the research capacity and infrastructure to conduct research that's relevant to the ACS program and policy goals. So making sure that we develop tools, resources, and approaches that equip the field, and that is meaning those that work in those particular programs. That can be early childhood education, it can be policy, social work, public administration, but equipping them to conduct relevant research with African Americans that's culturally rigorous, as well as informed by an understanding of our current and historical circumstances that really shape our experiences as a community and as a culture. And so with this, not only focusing on those that are already in the field, but also working with community-based organizations that are in the community and doing the work with these children and families. So working with them to provide a what we call a pilot project program, giving them a source of funding to do research on their own and on their own priorities that align with ours. And we provide consultation to them, as well as any kind of technical assistance to encourage them to also investigate the relevant questions within their community. And then finally, within this capacity building piece, we provide research mentoring and support to undergraduate and graduate students who are underrepresented in the health and human services fields. So we have specific attention on Black males because they often are not in these health and human service fields as undergraduate or graduate students. And so we highly encourage them to apply to work with one of our co-investigators for a year on a research project to, again, build their capacity and build their exposure and interest to go into research in these areas. Our second goal, or our third goal, around communication. So making sure that we have a comprehensive dissemination strategy. With the number of projects and different things that we have going on, we have a number of different audiences. So beyond those that are in the field who are practicing, so those can be federal and state agencies or local agencies. We also have a policy audience. So those who are driving a lot of the work that the federal and state programs do. We also have a community audience, making sure that those who are affected by these different policies also get the information and resources that we share through our work. And also making sure that the research community as well is one that we make sure, if there are different methods that we're using, particularly with working with African-American communities, that we get those resources and tools out and share those strategies with other researchers as well. And then the student community, as I shared with this capacity building piece, we want to make sure that they are also engaged in a way that's relevant and engaging to them about the different work and products that we have available. So tailoring different products, tailoring the resources, tailoring our communication plan to meet the needs across those various audiences is one of our kind of goals and objectives as well. So our main priorities, as it lays out what our work is, what we're supposed to do with our work. So we are to define and measure the needs, assets, and experiences of African-American children and families, particularly, again, in those programs. We're looking at the barriers and facilitators that impact human service provision and also their utilization by African-Americans. We're also looking at strategies. What are some things that the programs are doing to promote the social and economic well-being of African-American children and families. And then what do we find as some promising approaches for service provision to African-American children and families. And these mentioned again, their priority areas, those programs that our center primarily focuses on are TANF, their early childhood education, which is represented by early Head Start and Head Start. The Childcare is through a childcare assistance program. And then we have added in a priority area of fatherhood and family dynamics. Because it is the African American Child and Family Research Center, we thought it was important to also highlight the importance of father engagement across these different programs and the ways that many different other family dynamics impact our communities, whether it is grandparents that are raising their grandchildren, whether it is brothers and sisters who are taking care of younger brothers and sisters, whatever those family dynamics are, we want to make sure that they are represented in our research. And then as Dr. McGregor mentioned, we have some cross-cutting areas looking specifically at rural populations, African-American rural populations, looking at those who are justice involved, and also looking at those who have health and disability issues that may impact the way that they interact with these different programs. And this is really unique because, for one, these programs typically don't focus on health and disability issues. They don't really look at this broad spectrum of the social determinants of health within those programs. And then us too, as Morehouse School of Medicine, we tend to focus on a particular health issue, a particular health topic, as opposed to, all of the different things that can contribute to health equity. And so our project really does span the spectrum of those structural and intermediate mediary determinants of social determinants of health. And particularly, you'll hear in this presentation what we're thinking about as it relates to education, early childhood education, income, and just those different like social economic position items that are there in the middle. So we are definitely just charting a new path as it relates to the way that the Administration for Children and Families is looking at the well-being of their children and families by including some of these health aspects and just different perspectives. And I think it's a new take also for Morehouse School of Medicine to even be involved with some of these programs such as TANF or, Head Start and Early Head Start and just childcare assistance. These different programs are somewhat new, but again, as this framework shows, they all relate to advancing the health and well-being of our communities. So I've said a lot, and I just wanted to pause and see if any of our participants, if you all had questions, but I also wanted to see if any of you all have worked with any of these programs, whether or families who are directly affected by TANF or early Head Start, childcare assistance, any of those issues.
Hi, this is Michelle. I like the idea that you are including the families who live in the rural parts of our nation. They are sometimes so overlooked. So I'm happy that you will also be looking at that population of families.
Yeah, absolutely. Particularly as it relates to African Americans, because a lot of our research is usually on the urban, low income, urban, African American. And so we don't really talk a lot about the needs and assets of African American rural communities and children and families. And so we're really excited to be able to find out more information about their needs and their resources that they have and just their different experiences with these programs.
And it's Michelle again. Maybe I overlooked the slide because I'm looking at the slide on social determinants of health, but you have urban, but I didn't see a note on the suburbs. Sometimes we always forget the suburbs, and we always look at everything about the urban parts of our nation. And I sometimes think that families who live in suburbs, they also have needs.
That's an excellent point. That's an excellent point. Thank you for bringing that out.
This is Tracy. I haven't directly work with the populations. I've done research on it during my grad program, but thinking of other social determinants of health, when you think of cultural and societal values, the population where those who have survived, I call them survivors, domestic violence or human trafficking, that population is definitely affected in terms of getting the best health and mental care for not just the adults of the situation, but the children too.
Mm-hmm. Absolutely. Great point. Thank you so much. Anyone else want to add?
I haven't necessarily worked with those populations in that capacity, but I've worked with populations who, if I were to ask, did they have those resources, I'm almost certain that they would say yes. And I would say that because I worked in the same neighborhood that I grew up in. And it's the same thing. So yeah, and this in the area that I work in now, Morehouse School of Medicine, I grew up around the corner, well, actually a few exits down. The neighborhoods, they are more or less still the same, and we see gentrification and stuff like that going on, but they're still more so the same. So I'm certain. Yeah.
Okay. Thank you for sharing that. All right. Is someone else going to say something? I don't want to cut you off if you were. Okay. So I'm going to move into our main kind of question that we're looking at is how can we strengthen supportive experiences for African-American children and families? And so we're looking at what are some of the economic and health inequities that we can address. What are some of those barriers to benefits enrollment and barriers to eligibility? What are some of the issues around childcare assistance, and also making sure that particularly in the early childhood education space, that there's equitable funding to those providers. And that relates to those that are maybe home-based or those local kind of community-based child care centers, making sure that they have equitable funding. All of these things contribute to the outcomes, contribute to, again, the well-being of these children and their families. So I'm going to turn it to Dr. McGregor, who will talk a bit about TANF and economic mobility and kind of where our work is headed in this area. So Dr. McGregor, just let me know when you want me to advance the slides.
Okay. Certainly, we can move to the next one. So TANF, actually, some of you commented after Dr. Rollins gave a brief pause about not having worked with this population or in the specific capacity that the center is, but I don't know if you'll know how to use your raise your hand emoji, but how many of you are familiar with TANF and know what it is? Okay. All right. Since we're a couple of years into this Zoom life during the pandemic, I'm assuming that those who don't have their hands raised do not have a lot of familiarity with TANF. So TANF is a temporary aid to needy families. Just to give a general overview, it was established, the legislation for it in 96. I think it got rolling in 97. And, it's cash assistance to families that have different needs. It actually replaced AFDC. You might be familiar with that term. And that is, that basically was addressing the same need but was replaced by TANF, which was seen as much more restrictive in terms of how those policies were implemented. And so, if there was a parent who died, if there was a parent who was not consistently working, there are a couple of different eligibility criteria that allowed folks to apply for TANF. So these are just a few stats that are relevant to the work that we're doing, and perhaps you all as well. So Black Americans are 14% of the US population, but nearly 29% of TANF recipients are Black. TANF to poverty ratios vary by state and are the lowest in states with the larger Black populations. So I'll get into some of that a little bit later, but essentially, those who are in poverty, there is not a huge percentage of them who are participating or receiving TANF. And based on the eligibility criteria of the program, they should be. And there's all kinds of reasons why that's not the case, but it is striking that and disappointing that those ratios are the lowest in the states with the larger Black populations. And also TANF policies and practices shaped benefit navigation and utilization patterns among Black families. And so over the years, going all the way back to 96 up to now, there've been a lot of different trends that we've seen, but unfortunately, TANF has a long way to go in really meeting the need that exists in our society for those who qualify and need TANF. Next slide.
I was just going to add, I think that this percentage here is kind of a myth buster in and of itself, because I think the perception is that the majority of TANF recipients are African American, and they're not. So I just wanted to add that piece in there too.
Yeah, it is important to point that out. I think part of the narrative over the years, many would describe as racially discriminating or just flat out racist in terms of the perception of those who are receiving TANF. And so thanks for pointing that out, Dr. Rollins. So this is a graph representing the number of families receiving TANF benefits for every 100 families with children in poverty in 2019. And so if you just, you look at that, that key across the top, starting with the white and then the gray, and then it gets more deeper blue from lowest to highest percentages. And then you take a look at this map of the United States, I'm sure some things are jumping out at you. What do you all notice when you look at this map? If you've, just take a couple seconds to look at it. What is standing out to you? Oh,
it looks like a lot of families are not.
I'm sorry, say it again.
I'm sorry. It looks like there are a lot of states where families are not receiving benefits. Am I reading that right?
You are reading that correctly. And where do you see those states?
In the South.
In the Black Belt South.
Mm-hmm.
The Deep South. Got a lot of names for it. The Dirty South.
Right.
Starting up with North Carolina, coming west down through South Carolina, Georgia, Alabama. So basically what that's telling us is that for every 100 families that have children in poverty, only 10%, 0 to 10, if it's completely white, are receiving TANF benefits when there's clearly an established need. And so if you've spent any time or done any work or research with families, with groups who are oppressed and disenfranchised, you know that the South tends to be high in some of these categories, unfortunately. And this is another case. These programs should be benefiting these families who need them because they are supposed to be designed to allow them to move out of poverty, to be able to better take care of themselves and their families. And if it's not reaching them, we have to really understand why and then come up with solutions to address that. Anything else you all notice about this map?
Arizona, is that primarily Latino?
I am not completely sure, but I think you are it's probably close if it's not the majority. But the main point being there are non-white population is pretty large, and again we see a very low percentage in terms of those who are poor receiving TANF. So
One other
go ahead,
thing,
Mr. Johnson.
one other thing that sort of jumps out, if you combine the gray and the white, those are all red states.
That's what I was looking for. That's the other main
Yep,
thing.
yep. Those are all red states.
Yes, and I think there's pretty good evidence that is by design, and that is a very reflective of policies that conservatives tend to advance. And there was you can go to the next slide, Dr. Rollins. We can continue this conversation moving forward. So there was I'll give you a chance to look at that graph on the left. Black families' share of cash assistance recipients consistently below 50%. So starting back in 56 on up through 2016, there's been a decline. So it's not that it's just low overall, it's going in the wrong direction. So when you consider the 80s, late 90s, there was a rise in black families receiving AFDC. But their rise was disproportionate to the overall caseload. But that's the piece that was missing from the story. What was said was there is this wave, problematically so, of single Black mothers. I think someone just put it in the chat about welfare queens. That whole narrative was alive and well. And when you say that, the way it was discussed, the way it was presented in the media, the image that you got in your head was of a Black female, a mom with children who is not working and doesn't want to work and is gaming the system. But as Dr. Rollins mentioned, their participation and engagement in this program was in proportion to the overall caseload, and they weren't the dominant group numbers wise in terms of those who were receiving this cash assistance. There was actually a decline in Black families' share of cash assistance in 1996 as TANF came through. If you remember what I mentioned in the beginning, those TANF restrictions were more stringent. Those criteria, the things they had, the work requirements, for example, a lot of them were seen as restrictive. You had more people coming off because they weren't in compliance with the TANF requirements, and they often affected Black families disproportionately so. So this is some of the background that it's important for us to understand as we start to have conversations with our partners and communities and listen to what they're telling us. There's a policy environment that's important to understand. Okay, next slide. So part of my focus area, cross-cutting area, is criminal justice and health. So I want to take a little bit of time to talk about the reality in terms of those who are justice involved. And so if we look at incarceration rates of parents in particular, since the 1980s, the numbers have skyrocketed. The numbers overall have gone up. And it's the same with fathers and mothers. More than 75% increase in fathers who are incarcerated and 100% increase in mothers who are incarcerated. Those are staggering numbers. And so the next statistic I need to clarify a bit. So 1.7 million children experienced parental incarceration. That was the statistic in 2007. In 2013, when they updated the analyses, it was 2.7 million. Now the estimates are around 5 million children who have a parent that at one point or another had been incarcerated in jail and prison. Numbers are clearly trending in the wrong direction. We also know that there's a disproportionate number of African Americans who are in prison. That's the case for men and for women. I'm not sure if you all saw this. I want to say it was 3 or 4 years ago, but Sesame Street got involved in this. You know, they had a whole segment where some of the characters were talking to children, you know, who had incarcerated parents, and just talking about the reality of how sad they are. They miss their parents. They're not connected to them. And the reality is, when you lose a parent's income, you lose access to a lot of the things that are going to be important for well-being and emotional and mental health. There was a lifetime ban on receiving TANF with those with felony drug convictions. This came right along with that narrative of tough on crime and shrinking and ending the welfare state and not allowing people to game the system. But luckily, our community responded. A lot of stakeholders who care about Black families said, hold up, where is the research that indicates that those with drug felony convictions are somehow gaming the system? Where is the data suggesting that this policy was necessary? And over time, there continued to be information indicating that it did not deter crime, this ban. It wasn't a deterrent, and that there wasn't this large, massive movement in terms of fraud, you know, people gaming the system. So all the states have removed or modified that ban except for South Carolina, including Washington, D.C. And so I think that is maybe a case, if you will, that sort of illustrates what we can do when we come together and push back and talk about what is important to help families survive. Actually, these public assistance programs have been demonstrated to reduce recidivism, folks being on TANF, because they create access. The relationship between income and education is pretty strong, and people who have access to food and housing, when they're receiving cash assistance from TANF programs, these are the things that they're paying for. You know, not Mercedes-Benz, you know, not all the other things that it was said these families were spending money on. People need money to survive, including those who are justice involved. It actually helps them get out and stay out. And so this is just a brief overview of some of the issues that TANF and justice involved populations, I think, that are important to talk about and that we're going to be dealing with as we continue to develop our research questions and have conversations with communities. I think that might be my last slide. Yes.
Yes. Thank you, Dr. McGregor. So yeah, this, you know, TANF is historically just has had so much history and impact on African-American families and communities. So we really want to be very strategic about the research that we're doing and data that we share to be transformative, you know, to not just share the same things and share the same policies and strategies that have been put out before, but really to advance this program and make sure that it is reaching those that it needs to reach. One of the things that I wanted to add as we were looking at that map of the country, and as it talked about those families that were living in poverty, and what I wanted to point out is that also in the South, we do have the highest percentage of Black recipients of TANF. However, the amount of funding in the South is so low. I want to say in Georgia, maybe $200 a month or so. But the actual amounts that are given out in the South to families is really low. And then as we talked about, there are a lot of barriers to even receiving that. And that map also points out that the majority of families that are actually living in poverty and need it are not receiving it. So just wanted to clarify that. But thank you, Dr. McGregor. Were there any questions or any comments regarding TANF and economic mobility before we move into early education and childcare?
I have a question. This might be a silly question, but since I don't know, I'm going to ask it. I would like to know, though, what do you believe are the barriers that prevents families from receiving TANF?
Good question. And that is one that we are asking, right? We are asking the community members, to tell us why haven't they applied? If they have applied, what were the reasons for denial? That type of thing. And so at least from, past literature, what it seems is that it's really a hectic process. For one, it's a rigorous process to even apply. A lot of folks also talk about the treatment that they receive, as far as, customer service. I'll just say that, not feeling like, they're viewed with respect and dignity and things like that when they're just trying to get help for their family. But there are a number of hoops. There are work requirements, which is another big change that was made to TANF from AFDC that can sometimes just be kind of counterproductive. If you have children, if you have a health or disability issue or something like that, then you're not going to be able to meet the work requirements, and therefore you'll be subject to sanctions from TANF and different things like that. So those are the things that have been highlighted in the literature, but we want to hear from community members now, particularly after the pandemic, and there were some things that were lifted and changed with TANF programs. If they still haven't applied, why not? And what were some of the barriers they even experienced during the pandemic? Dr. McGregor, did you want to add something?
Yeah, I just wanted to add one thing real quick. The increase in TANF, the cash assistance over time, has not kept up with inflation or the cost of living. So we're talking about declining resources from this program. There are also some of the jobs that folks had access to were not enough to meet their needs. So people were really in decision-making, scenarios. Do I, continue to try to work outside of TANF to get paid under the table, to do other things that wouldn't be acceptable under this program? Or do I join, register to receive TANF? Oftentimes not being able to get a job, but they're paying you low wages, of course, to be in a training program. So there's all these restrictive ways that created barriers for people who either trying to get access, or then once they got access, were not benefiting them in ways that allowed them to, have a good quality of life and lift themselves out of a low income status and poverty.
And I have a final question. The TANF program, is it like linked to the free lunch initiatives in various states, or is it very different? Because I'm asking the question because I'm thinking, okay, then if it's not linked to the free lunch program, maybe many of the kids who do get free lunch might also benefit from getting TANF. So it could be a way of enrolling more kids in the program. Just a thought.
That sounds like a wonderful thought. It sounds like a wonderful idea, to make sure that, again, those that need it actually receive it. And so, but no, it is a state funded, kind of block grant, and is governed by each state very differently, with different requirements, different applications, different eligibility across the states. which makes it very difficult for us as researchers to find data that's somewhat consistent across the board, and particularly as it relates to disparities in race and in place as well, because what's done in Atlanta isn't the same thing that's done in Mississippi, or what's done even within those states is different. It looks different. So we're working with that challenge and looking at different ideas, such as what you brought up, Ms. Brown, around, what are some promising strategies or approaches to make sure that these families can get what they need. See something in, okay. Anyone else have comment or? Okay. Yeah, so we will move on to early childhood education and child care with Dr. King Gordon, and you can just tell me when you're ready for me to move your slide.
Sure, I'll jump in. Thanks, Dr. Rollins. Just in addition to the conversation, which is a good segue in terms of those barriers, just in my own reading and knowledge, literacy is usually a challenge too. Sometimes in the home, there is maybe a limited of high school education. And so if it's a young child, they're the ones who's helping the grandmother or father or mother. Of course, Dr. McGregor spoke about incarceration. So there are so many challenges. And if you can't read an application to complete it and to meet those requirements, that's usually a barrier, which is a great segue into my education piece. So that's just another barrier I wanted to add into Ms. Brown, to your question. Next slide, please. All right, so defining high quality early learning experiences. So the way we captured this was looking at data and saying, what is needed? How do we define that children and families are receiving the quality of education and while they're in school? Oftentimes as a previous educator, some of my students, there were good students, but they were hungry. And so how can you focus if you're hungry? And so you're not getting the quality of education. And so that brings about, as what they would label it, ADD, or put them in another special class, or they have to repeat a class, for a whole nother year. But there often comes with behavior challenges because of those things that stem from one thing to the next. So when we think of quality learning and experiences, we look at accessing assessing school readiness. How are our schools assessing and preparing for communities and families, especially of Black and Brown children? What are the impact of high poverty? There's students who literally, they're waiting for a bus to get to school because they know that the meal that they would get. And so they're in this high poverty areas, and the neighborhood looks as such, and they haven't seen anything else. So that is become now this impact, of the poverty area. Oftentimes there's probably some community center or a church that can support some activities or some summer learning or some type of things to kind of engage children and families. But that's also shortened because if resources are low and there's nothing else to support, then other challenges come about. And then we look at low resource, our rural communities. Some communities only have maybe one small grocery store. So a Walmart would be huge to them, So when you think of a one small grocery store, and Dr. Rollins and I have gone to Cordele, Georgia to present with another project. These are tiny areas and you have to drive miles and miles to get to one store. So if you think of a rural area that's already having challenges within the school, poverty level, think about getting food and what are those resources, and not just food, but resources to books, a library, riding a bike, or donations that may come to areas that can support our children and families. And so, and access to healthcare. Oftentimes there's maybe one hospital that's maybe 20, 30 miles away. So if you think of people getting sick, how are they getting those resources when you're in the low income and low poverty area? And again, touching on health and wellness supports, is there a gym in some low income rural communities and poverty areas? There is no gym. And if there is one, it's usually the basketball players or something close to a barber shop. And if there's a fee, there's less people that will look into health because you don't have the gym membership or the fee to pay for that. And so that becomes a challenge with health and resources. Social determinants of health. Both my colleagues mentioned this already. There's so many challenges in access to healthcare. The pandemic has taught us so much when people realize not only do I need help, how do I have access to get the help? And so many of our elderly population lost their lives, young people, because they did not understand, what are those health challenges? When do I need to seek a doctor? Or do I just take a Tylenol and it's okay? Oftentimes in the Black families, we have so many remedies that would work and help us to feel better. But in the other instances, you need to see a doctor. But there are often barriers and challenges to do so. If you have limited healthcare, no insurance, you may have a job, but that job does not provide enough insurance for you to even purchase that because you need most of your money in your check. And then we looked at quality ratings and kindergarten alignment. These areas of placing students in areas that they can get help. There's your Georgia Peach, and there's so many things. They may be called something different in your state, but here in Georgia, there's this Georgia Peach that that can support, and there are other names that it's called. So if you all know it, you can share that as well. But if you're making a certain amount of money, you won't be eligible to get that. And so if you have a certain amount of children, how does that quality of life now that you prepare for your children and kindergartens, and they get to provide, for free lunch or free daycare, or it's half a day. And so again, if you're in these poverty areas, you now have to do some type of research or some type of seeking out or word of mouth to find these areas to be able to support and have the kids in a quality school, or the school that's available in your county or your area. And again, this is all addressing how do we define, quality learning for our students with all of these challenges that we're looking at. Next slide, please.
I was just going to add, in particular with this pandemic, the communities that we've talked to so far have really brought up the impact of the pandemic and that virtual learning piece, particularly in rural communities, and their children, now that they are back in school, really having a hard time catching up. Because they weren't able to access a lot of the content and get that direct kind of teaching and classroom environment last year. So that, access to internet and that type of thing, as just leaning to the low resource rural communities, that was really impactful for the early learners and for even elementary age.
Yeah, thank you for that, Dr. Rollins. I recall even our church, we donated iPads so kids in certain areas could have that. And we had families where there were 5 children in the home with 1 laptop, or they were going to the closest area, maybe the in New York, I don't know, we call them bodegas, to find some kind of connection with internet. So thank you for reminding me of that point, that even with that, and again, I mentioned earlier, the students are having to repeat courses, not just because of food, but access. And when you think of not having a laptop or iPad to do the work and the support, that was a big challenge. Thank you for mentioning that. And so our research priorities, if you recall, Dr. Rollins mentioned our areas of research priorities, but these are the different arms under these areas. And so we talked about TANF and early childcare and Head Start programs and, policies, and how can our project help to implement and share policies with our stakeholders and leaders who will see that this is an important work and why this monies and this research is important. And so we will look at adapting a quality rate and improvement system. How do we track that? How are kids doing post the pandemic? How are they doing 2-3 years later? How are they doing in their growth wise? In terms of students being able to intake the work, but process it. A lot of that is happening while kids are in classrooms. They're so distracted by so many things. And this includes, the quality rating of our teachers. The pandemic has also changed a lot of that in terms of how teachers teach. A lot of them have left the profession. A lot of them are burnt out. A lot of them are not getting paid. And so here in the state of Georgia, our governor they're giving bonuses, to teachers to kind of improve the quality system. How can we keep you on board? And now teachers, some who have stayed on, are now looking to increase their education, get higher degrees or more in being certified, not necessarily a degree, but getting certified so that they too can increase their pay. And so it's both checks as we look at students, parents to students and students to teachers. And of course,
Dr. Gordon, sorry to interrupt you.
Yes.
Just to add a caveat to the teaching situation in Georgia, I live in Gwinnett County.
Sure.
And as a whole, this is my experience. For those who want to enter into the education field, who did not necessarily go to college for education, Georgia makes it difficult for those who will probably be great teachers to get into the teaching profession, because there's what's called the GACE. You probably are familiar.
Yes, I'm aware of it.
Okay, so in order to get a teacher certification, you first have to pass what's called the program assessment. And once you pass the program assessment, then you can either study and prepare for the teacher certification, or you take it before you're hired or after you're hired. And so it's as if they're asking you to show them your worth by this program assessment just to even be recognized to take the teacher certification. Are you following me?
Yes, ma'am.
And
Yes.
so you're paying to take an ethics exam. You're paying to take the program assessment exam, which is just an exam just to get into the certification. And then you're paying and preparing for the certification exam. And so it's disheartening when those who really want to bring value to the classroom, male and female, they're being challenged every step of the way, which makes it harder for our Black and Latino and maybe other ethnicities get into the classroom. So I just thought I'd throw that in there because it's I know a lot of people that's been so frustrating, and they just decided, well, I'm not going to show you my worth by taking this assessment that really has nothing to do with me being a good teacher or not.
Yeah. Yeah, no, thank you for that. That's quite timely in this, and it's a conversation. So yeah, jump in at any time. And it has, certain states has made it even harder for teachers. And they think of the funds that they would have to spend to even get certified and do these assessments. And let's not mention, most teachers sometimes provide all of the resources, if not in their classrooms.
Correct.
And so when you think of funding and learning and all of the other things, and then you have to teach, 15 to 20 kids, it's a lot. It's a lot. And that's why I mentioned burnout earlier. So thank you for that. It is happening across the states. And a lot of teachers have left the profession.
Right.
Yeah, because of that, because they're feeling, that their time and years that they've supported and done, you're now bringing all of these requirements that could potentially take them out of the classroom.
Right.
Yeah.
Right.
Yeah. No, so thank you for that.
You're welcome.
And that leads right into the next, thing when we talk about, accountability. We kind of touched on that, making sure that, there's quality systems, programs for our early learners, but ongoing technical assistance for teachers. Teachers want to learn, but if there are no support, just this week, those of you who live in Georgia, you would see that there are schools that I think it's the DeKalb County superintendent was fired. When they look at the conditions of the school, the students took to their own social media, they did their own research and work. And so here you have high school students who are recording the bathrooms with mold and where they should have recreation and basketball. Everything is broken and torn down. And so they're saying, how can we learn when you say we have a gym period and there is no gym? And so a lot of this, and it's probably the back scenes that we didn't see why this superintendent was terminated. It's because there was no accountability. There were no checks and balances. Things were just happening in the top, and all the conversations we hear, because I'm still a part of a lot of that education group in my past experience, the northern areas in Georgia, they get most of the money and they get the attention and they get the support and the resources.
That's not true. That's not true.
But if it's not happening.
Well, let me not say that it's not true. Let me say that I don't think the funding is spread across the northern county schools. Like I said, I live in Gwinnett County, and the school that my daughter goes to, she has seen roaches and mice and trash all in the hallways. The bathrooms are filthy. And so I don't know how the funding is dispersed. I know that it's not funded correctly across all of the schools. And then I also wanted to add that the superintendents, if they're politicizing their position and not really getting to the heart of the problem, then the funding is not going to be allocated as it's supposed to be, because they're in someone's pocket or someone is in their pocket. And that's the problem. You can't have these positions, these high power positions, and forget why you're really there. It's not about having the credentials behind your name. It's not about being able to hire, fire, or just be on TV or on social media. The bottom line is ensuring that each and every child, regardless of background, gets the proper equitable education that they're supposed to get. And I'm sorry, I'm very passionate about that.
Oh, so am I. So you and I could be here till 8 o'clock. Trust me. But yeah, no, it's a conversation we're having, and we're happy that you're engaging with that. Dr. McGregor, you came off mute. Did you want to add something? I don't want to miss that.
Well, I do. I'm from this area. I'm born and raised in DeKalb County, and was a part of that in the sense that my dad was a school board member throughout the 80s and the 90s, and he was the first Black school board member in the history of DeKalb County. And so we went through a lot of that in terms of the differences and how there seemed to be less in the southern part of the county compared to the north. The teachers were less experienced. The equipment, the grounds, the materials, there was a lot of that going on. So there is definitely a historical precedent for that type of discrepancy. And as Dr. Rollins pointed out, we have to be really, we got to drill down and look at data and try to understand what these patterns mean for in terms of how they inform solutions. So I just wanted to add that.
Yeah, and I'll jump right down with policy implications. Where that funding, as you mentioned, Tracy, where these funds are going, that is, it's your leadership, it's our parents or local community members getting out, when they have these PTAs, who's going to come out, who's going to be a voice, as a former educator, when I had PTAs, I saw everybody on the first day. As the school year progresses, I see maybe 5 parents, and they were not of our Black and brown families. And that's just being transparent. I'm not saying our families are not engaged, but the priorities become different. And it's only when it's an emergency that we see these parents sometimes. And so our parents have to be that voice as well. When we think, I always say, as parents, we are the first educators for our children. And so you have to be able to be the voice. So hopefully with this, there are policy implications that we can begin to set the tone and set, policies and systems so that we too can be a voice with other community members, other leadership, stakeholders in this great work. Next slide. And again, our research methods, as we think about designing and assessing, we want to design a community-driven participatory research agenda to conduct focus groups, and surveys with our community members. Dr. Rollins mentioned earlier our listening session. She'll talk a little bit about that later. But these are part of to get into the needs and the priorities as we listen to different communities from different counties, different states, and we'll look at secondary data, and how those findings can drive at the national level. And then as we look to, outcomes of the program, disparities in outcomes and programs participation and promising practices, we're hoping to get this on the shelves, of other research programs and projects, institutions, organizations, wherever we can get that to be able to just share, this is what we found, and this is what we think can help to improve the quality of education and Head Start and early learning programs. And so I'll pause there. I think this is my last slide. If anyone else has questions or comments, certainly we'll open this forum now.
Actually, Megan just put a question in chat, and I was going to tap into that same question, Megan, just as it relates to increasing engagement. And that's one of the things that we do want to find out, in terms of how or why, our parents might not go to some of these different things or voice their opinion in different meetings and things like that. I know from just kind of my father engagement work, a lot of times these spaces are not friendly. A lot of times I can even speak from my personal experience, the quote unquote parent workshops are at 9 to 11 a.m. So I want to be engaged. Right. I want to, see what's going on with the school and whatnot, but I cannot be there, in the middle of the day, or the beginning of the day or morning like that. So it can be a number of different things in terms, work schedule, it could be environment, it could be a number of different things that contribute to a lack of engagement. And then where there is heavy engagement, then where is the power, right? So do you, even if you are engaged, do you have the decision-making power to really make some things happen? And so we definitely want to hear from, again, the community members and, get their take on what's happening and how we can be a resource with data, with resources to really help to improve, again, these programs and policies.
Yeah, and even to your point, Dr. Rollins, just as something simple when a meeting is 9 to 11, you're at work, you have a family, you have kids. And then sometimes there's a challenge with young parents, they're younger parents. So they may not know or be even aware. They get the tools and the materials, but if you're not taught, it's like, okay, how do I do this? Especially being a first-time parent. Most people don't know their local congressperson or representatives in their areas to even know that they have a voice and can write letters. So I think it's how can we get them engaged in terms of just PTA engagement, letting them know, here's your congressperson, here's who you voted for, here is that you can have an email or a call, or you can visit them, because as they, everybody says, we're paying you. I don't like to just drive on that. But there are ways, there are mom and mom groups, there single mom groups, there married groups. There's so many groups and areas. We just have to educate our communities on what those resources are, so that they too can tap into that. Because obviously one voice is just one voice wouldn't do it, but more than one obviously will bring together, a stronger voice, and to be able to have a seat at the table. And so I think once we start educating our communities and parents and fathers, that will bring about change, but they have to know that their resources are there and their congressperson, man or woman, can speak on their behalf.
Yes, and Phoebe is bringing up a great idea about the parent groups, and there are some, particularly, with this pandemic, a lot of folks took to social media to create groups and things like that. I know in my county they have a, county moms and dads or whatever, and they post different things in there. So that's a great idea, but what it's also telling me is that may be a great place for us as well to tap into, in terms of resources and sharing information with these parent groups outside of just, going directly to the centers or something like that.
Yeah, absolutely. Thank you all so much. If you have questions, I'll be checking the comments and as we continue with our presentation. Thank you.
And so I'm going to go right into talking about, because we have heard so much, and I know probably your wheels are turning as well, in terms of like, well, this is a lot. So like, what do we do, particularly with our community, with the historic context, with the current context, like how do we even begin to tackle some of these issues and make a difference? And so as Dr. King-Gordon started to say, we are driven or establishing a community-driven participatory research agenda. And the way that we are doing that is through a community-based participatory research approach. And so we're making sure that, with everything that we're doing, we are working with the communities who are affected by this issue, from the planning of things all the way through to the sharing and development of profiles, resources, journal art, whatever it is, however we decide to share. We want to make sure that the community is engaged in all aspects of this process, because we do truly believe that involving them helps us to have a better eye on what needs to be addressed and the ways in which they need to be addressed. So we are doing this community needs and assets assessment. I'm emphasizing the assets because often what we hear a lot is about the deficits. And so we really want to stress that we understand and know more now than ever that there are existing resources and assets in the community. A lot of times, as Dr. King-Gordon said, we just need to lift those up and make sure that people are aware of them and different things like that. And making sure that we're aware of them as well, so that we don't recreate the wheel, but that we, basically strengthen or mobilize some of those existing resources. So we're doing this assessment to understand the emerging needs of the residents of the community. We're also looking to figure out what's the role that our organization or other organizations could play in meeting some of those needs, including the Administration for Children and Families. We want to identify those economic, social, and partner resources that are already in the community that can help making sure that we look at some of the significant public policy issues, because we said before, there are certainly political determinants of health that impact all of these different programs and all of these different circumstances. So we want to make sure that we are aware of those, education of those community residents and leaders about those identified needs is also a significant purpose of this assessment. And making sure that we explain to the community kind of how and why we're making certain decisions and why we're prioritizing certain issues or allocating certain resources to a particular topic. The assessment will kind of give us the data in the background to be able to explain that. So the first step in the process is to create an assessment plan. And so again, because we are a national research center, we had to figure out, well, where we want to start. How are we going to tackle this? And when we say community engage, who is our community? And to be honest with you all, it was a little bit of a difference in how we define community. And I think it's just because of our training at Morehouse School of Medicine and the work that we do. When we say community, we literally mean those who are program participants, community residents, those who are directly affected. But there are many communities, right? So the community, I think from ACS perspective initially was those federal and state agencies that administer these programs, which they are one, that they're a practice community. But for us, when we're looking at how do we really make a difference for these families, we really want to target those and work with those who are affected by these programs. So we have created a assessment team. So figuring out, who all is going to be a part of this needs and assets assessment. We've done a timeline and assigned responsibility and figured out our data wish list, which has been quite a task, and figuring out, again, there's so many things to look at. And so what is it that we specifically want to focus on? So I'm walking you all through if these are things that you all would like to do with the work that you're doing. So for us, the selected states are our community that we're focusing on this year. And this is a 5-year grant. So this year we're focusing on Alabama, the District of Columbia, Georgia, Louisiana, Maryland, Mississippi, and Virginia. And even from that, so these states were selected because they have the highest percentage of African Americans who are receiving TANF, who have African American children in early Head Start or Head Start, or receiving childcare assistance. So out of the 50 states, these 7 had the highest percentages in those areas. But then, of course, yeah, we could say Alabama, but where in Alabama? So we then had to break it down and look at the data in each state and see which counties had, again, those kind of high percentages of African Americans who receive these benefits from programs. Also, we wanted to look at the percentages of African American children and families that were living in poverty in these counties. And that's how we kind of came up with the communities that we would reach out to. And so with that, we developed flyers, but we also have identified community partners, community-based organizations, or national organizations that have affiliates in these states who can connect us with programs and agencies who are working with the African American parents who are recipients of TANF and et cetera, who can enroll or can participate in a listening session with us. So we created our data collection plan. So we have 2 different ways, as we talked about. We're doing some secondary data collection, looking at national and now state data sets, as we found some gaps in the national data sets, particularly as it relates to race variables and geographic variables. So we've talked about a lot how important it is to look at the disparities across place. And we know things are very different across a state. So we really want to make sure that we look at the state's data and make sure that we can get to the county, at least the county level, to understand enrollment and understand who is receiving these programs or who is not. So we are looking at the secondary data, and then we're also doing the primary data with the listening sessions as well as a survey. So for folks who cannot participate in the 3 to 5 listening sessions that we're having in the state, we do also have a survey where folks can share their perspectives on their experiences in the program, or in just making sure that we capture all of the perspectives of folks that are affected. Okay, I see Ms. Brown, you live in Maryland. People might not look to study Montgomery County, but consider Montgomery County in your work. Yes, yes. And it's not at the top of my head of which counties, but I know Our partners recommend Prince George's for one, just because of the African-American population there. But there's some others in Montgomery, some rural communities that they wanted us to look at as well.
Yeah, PG County might have the highest per capita income of Black folks in the country. I don't know if it's still the case. It definitely was a while back. And I think, one of the potential benefits of looking at places like that is for those who simply have like a reductionistic class analysis. Once again, race will emerge as a determining factor, even when you have a high income Black folks. And I think it's important to center intersectionality in the way we proceed in terms of how we're defining our questions and the tools that we use and the lens that we have. I think it's important.
Absolutely. Is it based off of the criteria of looking at the percentage of families in poverty? It was not on our list. But then when we reached out to our community partners, they were like, this is going to be interesting for you all to look at. So you may want to look at Prince George's County in addition to some of the rural counties in Maryland where they had a high African-American population as well. So of course, the next step, once we get all of this information, is to analyze it, making sure that we have a plan for that. It's going to be a lot of cleaning. We're already going through the process of standardizing some variables, just again, because we have to pull together so many different data sets to make a complete, kind of picture and answer some of the research questions that we had. And to be honest, you all, the questions are not that hard. They're really not. I mean, we really just want some descriptive information about, how many TANF recipients are in a particular area, and we may get an overall number, but in terms of breaking it down by race, that's where things kind of go crazy. Also with Head Start, we can get the enrollment numbers. We can even get the age groups, the number in different age groups, but we can't get those numbers by race, not from a national data set. And then, like I said, the geographic variables. So we're having to put together a number of different data sources to get a complete data set. And so when we do that, we do want to create kind of an aggregate picture of what we're finding on a national level, but we also want to create these community or state specific profiles so that, folks kind of know what we found and what we heard in their communities if they wanted to do their own type of action and use the data for themselves. We're also collecting some qualitative data again, because a lot of our questions are around, what's the why, as Ms. Brown had asked earlier, like, why aren't people, what are the barriers? So we are asking those questions, and so making sure that we organize and analyze that data as well. Let us know we have 10 minutes left. Do the evaluation. As a former evaluator, do the evaluation. A final step is to report and take action. And so, again, with us developing our research agenda, we're going to have to figure out, what are the things that we want to address? What are going to be the priorities based off of what we heard from the community? What were those areas that need to be addressed to improve and strengthen their well-being? And again, to go towards our vision of advancing health equity. So, in looking at that, we have to kind of consider the burden. So how many, folks kind of brought up a particular issue as a burden in their communities? What are some of the resource requirements to really address that particular issue? And what would be some of the potential effects of having an intervention in that particular topic or area? So those are some of the things to really consider when we start to set priorities. And then finally, I wanted to leave you all with some other kind of action planning guides from other national or foundations like CDC or Robert Wood Johnson Foundation. If there are policy, system, and environmental type of things that you're looking to do, there's different guides. The Change Action Guide is a great one to look at. But there are also others, and I know Healthy People 2020 is past, but but they have a great framework, at least for, again, once you have some data now, how do you plan what you're going to do next with it? So I believe that is it. Thank you all so much for listening in and for participating in the conversation with us on this afternoon. Please feel free to reach out to us if you have any additional questions, and follow us on our social media, Facebook, LinkedIn, Twitter. Just follow us so that you can stay abreast of the different things that we are going to be sharing over the next 5 years. So thank you again. And if you have any questions, feel free to ask them now. It looks like folks are going out, but yeah, I'll stop talking and turn it over to you all.
Now, this was a great session. So thank you to my colleagues. Enjoyed it. And thank you all who shared your thoughts and feedbacks and comments. Thank you.